Hello, I'm Dean McKnight, and welcome to another edition of Taking Back Our Neighborhoods, a production of Operation Our Town. Let's talk about the mission of Operation Our Town for just a moment. To facilitate partnerships between community and business to fight drug use and crime through proven law enforcement, treatment, and prevention techniques. Today in our society, you pick up the newspaper and every day we see where somebody has abused prescription drugs. Today we're going to talk about that very subject with four experts on the subject. To my right, Dr. Grant Hormell. Dr. Hormell, and Jim Walstrom from the Pennsylvania Office of the Attorney General. To my left, a lady that you've met before on this program, Judy from the Blair County Drug and Alcohol Program. And last, Peter Kreckel from Thompson's Pharmacy, a pharmacist who maybe understands this better than any of us because he's there day to day hearing people talk about their problems. We're going to begin by saying, with all the things that are happening legislatively, Judy, maybe you can help us understand what's happening on the legislative front to monitor and check on prescription drugs.
Well, one of the efforts that Operation Our Town actually initiated back in the fall of last year was to see if we could get legislation that was a little bit stronger on the reporting of prescription drugs that are being dispensed in our community. We actually worked with Representative Geis, had a informal hearing with the Judicial Committee from the House, and from there, though, it rolled very quickly into some legislation that will help strengthen our current reporting process for medications, prescriptions that are dispensed. This reporting process currently is transferred over to the Health Committee. It has since been reviewed, amended, and now is out of that committee and onto the floor of the House. At the same time, the Senate reviewed this new initiative or improved initiative and have developed their own version of the Senate bill on their side. So right now, it's on the floor of both of the House and the Senate to be reviewed and possibly approved for implementation.
Any idea a time frame of the implementation?
At this time, no, I've not heard any time frames on it.
Peter, when this legislation is finally enacted, how will it affect the pharmacies and the pharmacists?
I think it's going to affect us very positively because right now we have a rather shipshod way of checking these things. We do report Schedule II substances to the state, but that has such a long delay, and Schedule II substances are the ones with the most abuse potential. You have to have a new written prescription each time. It can be written pretty much for a month. It's OxyContin, Percocet, and those. So the great big drugs for abuse are well monitored, but there's a delay. What we pharmacists traditionally do is bill insurance companies, and the insurance company will flag it if the patient went to another doctor or to another pharmacy and got it filled. The first clue that we have as pharmacists is when someone comes in and says, I want to pay cash for that prescription. That's a big red flag that goes up and tells us that they might be doctor shopping and probably pharmacy shopping. So it's going to be a great benefit for us to have something in real time where we can look and see where these patients have been, both as far as pharmacies as well as physicians go, and then we can report to the physician that wrote the prescription.
So it begins with people coming into the counter of the pharmacy.
Exactly, and then the database is going to be built off of the information that we provide as far as the medication, the physician, and then all the numbers thereunto attached.
Dr. Hormell, I can't help but think that while we're here this morning, somebody's in your waiting room saying, how come the doctor isn't here?
Well, I've been doing this for a while, about 20 years, and my patients know that they can wait for me. I'll be there shortly.
That's wonderful. How's this going to affect you?
Well, ideally, it would be pretty invisible for the prescribing physicians. And I would like to separate, the legitimate drug use, for example, when I write a prescription for a medication that has a potential to be abused, from the illegitimate. And this system is by design will catch and flag, as Pete points out, more of the illegitimate use. The high volume, the doctor shopping, the real time. He'll have the availability to go on the computer while that person is in the pharmacy and to see if there's any kind of behavior that might trigger a red flag. Pick up the phone, call me. Did you write this? Yes, it's legitimate. No, I haven't written that. Thank you very much for calling. These are the kind of things that we'll bring it up to speed, so to speak. So I don't see any kind of a hurdle, any kind of a barrier from a prescribing perspective.
Will actually make it better.
I think so. I think it'll help tremendously.
And Jim, how about law enforcement? You guys have to be vitally interested in this legislation.
We are. Right now, as Judy was saying, we do have a prescription monitoring program in place, but all that monitors is Schedule II substances, as Peter said. And in Pennsylvania, there's 5 schedules, and they are leveled by severity of abuse and lack of or needed medical use. Schedule 1s are street drugs, and as we go down through 2 through 5, they were set by levels of abuse. So right now, all we see are Schedule 2s. Which are the ones that are mostly abused. But as Grant was saying, there's no real-time reporting to this. It comes in weeks later. So we're able to see what's going on. If you go in and get a Schedule II controlled substance, we're able to see that, but it could be weeks later. This system will allow us to look at all the schedules. And hopefully the individuals like the pharmacists and the doctors will be entering that information in a timely fashion. So as close to real time as possible, if you go to a doc and then to a pharmacist, the pharmacist should be able to see that you were at the doc, and then if we want to see what you got through a legitimate investigation, obviously, and that's one of the tools that it has to be. It has to be a legitimate law enforcement investigation. The Attorney General's office will basically be at the head of this for law enforcement. Other law enforcement agencies will contact the Attorney General's office if they're interested in obtaining that information. We will be the clearinghouse, if you will, for that information, as per the legislation that's on the table or on the floor right now. That obviously could change, but we should be able to see then that you went to this doctor, then you went to this pharmacist legitimately, and you got this prescription. We should also be able to see if you've gone to this doctor, this doctor, this doctor, obtained 3 prescriptions, then went to this pharmacy, and this pharmacy, and got all 3 scripts for the same drug or similar drug filled in the same day or within a short period of time. So that will give us the ability to watch a little closer as to what's going on. And I'm sure later in the segment of the show we'll get into the severity of abuse of legal drugs, but that is a huge problem for us right now in Blair County.
Judy, we've heard from the entities that this legislation will affect. Can you kind of simplify what this, once again, I know you told us earlier, but now we've heard the users talk about it. Can you kind of reiterate what this program is and what it's about?
This program, actually, when you look at it, it's not just new to Pennsylvania. This is a national program, and it is a program that has taken off across the United States, each state developing their own reporting process, but it really is about an environmental strategy of prevention. And what it does, it provides that change in attitude and policy at that level of how we manage prescription drugs in our communities. The one thing that when we did have the House, we went to the Judicial Committee to present this program and the more expanded use of this program than what we have currently, we had people advocating it from the physician side, from pain management physicians, psychiatrists, because they see it as a great tool for them, because that when someone comes into them, they're not sure if this person is just drug seeking or has a legitimate pain. They see this as an ability to really be able to serve their patient much better if they have that information available to them, especially a pain management clinic who has to adjust medications to ensure that person's pain is controlled. So it gives them a little bit more of a tool to use to make sure that they're adequately treating a person correctly and that they're not drug seeking.
I was going to suggest, Dean, one thing is when you're treating pain, your pain might be one level and Peter's might be another. So when you're telling me about your pain, my armamentarium would be different for the 2 patients. By having something like this in place, it kind of levels out the playing field for the episodic treatment. The person who goes to the emergency room, the person who shows up at the family doctor, the person who doesn't have a family doctor but might be traveling through the area and lost my prescription. They get it filled in Altoona, they drive to Johnstown to see another doctor and maybe to Erie to get that one filled. By having this real-time system in place, it kind of levels that all out.
Now, Dr. Hormell, what will this put additional burden on your staff to do this?
It really should not. from a personal perspective, like I say, I'm family practice, I've been doing this 20 years, I know my patients. I think if there's going to be a burden, it's going to be on the pharmacies where they fill it, and I don't even know how the third party send away your prescriptions are going to work with some of these things. One of the problems, I'm sure we'll get into this later in the show, about disposing medications that are left over. When you send your prescription to Medco and you get a 90-day supply of something, and I change it 2 weeks later, what do you do with all those pills? Eventually, your stuff's going to stack up. It sits in the closet, on the coffee table. The grandchildren come by and see some of these things. So, I mean, we have to ratchet down from different perspectives other than just this legislation.
It's a great question. Peter, now, once this goes into place, and you're going to have this information, and I'm not feeling well, and I send my neighbor boy or my neighbor girl to the drugstore, and as you said earlier, one of the tip-offs is, does this look like this person should have this prescription? If you're suspicious, and this legislation or this new law has given you the opportunity to say this isn't real, what do you do then? Do you tell me what you do once you find out it's not true?
Well, the first thing I would want to do is, if they say they're representing you, is get your phone number and call Dean McKnight and say, did you indeed send this patient down? She might very well have stolen a prescription, out of your car. There are a lot of things that, when somebody serves as an agent, it's totally legitimate and legal, but I need to check and make sure that she's representing you. So the first thing I'm going to do is call you at home, and you're going to say, oh, I'm really sick. I hurt my back shoveling snow. Yes, that's real. That's fine. If I question then the prescription that maybe you ascertained, we can call the physician. And that's what's neat about Altoona. It is a really close-knit community. I have no problem picking up the phone, calling Dr. Drass, the pain management. I also teach up at St. Francis University in the physician assistant program. And because of that, a lot of these kids in the emergency departments are PAs that I know. So when Mr. Kreckel calls, I get a timely response. So I have a lot of connections, both professionally with the physicians and the physician assistants too. Because we see a lot of these people jumping to the emergency room, and they call them GOMERs, G-O-M-E-Rs, get out of my emergency room.
Who calls them that?
It would be you physicians, I believe, call them that. And the idea is you give them 12 Vicodin, 8 Percocet, and get them out. Well, I think that's going to also help with that, too, because then if you produce a prescription, bring it to my store, and I see that, you've been doctor and pharmacy shopping, then I can make a phone call. One of the kids, probably Chris Holland up at Altoona ER, will say, okay, Mr. Kreckel, I didn't know that. And I'm sure they'll have access to this database too. So I think it's going to eliminate a lot of this stuff, because right now it is a rather, as I describe it, a shipshod way of providing health care, or these little quarter sheets of paper that people pass around and get drugs from. I'm all for the technology. We have computers, we bill insurance companies, we spend more time billing insurances than we probably do talking to patients. And so I think it would probably fit nicely with the software. Some adjustments for us will be fine.
Jim, if one of your law enforcement people got a call from Peter's drugstore and said, there's a person here and we know this is a fraudulent prescription, tell me about the law, how the law interacts with the pharmacist and the doctor.
Well, generally with the Attorney General's office, because we're so short-staffed, we're not a quick reaction law enforcement agency. If that were the case, where a pharmacy within the city of Altoona called us and said, I think I have an individual here, fairly sure that this is a forged script. I called Doc Hormell. Doc said he didn't write it. The numbers are a little wrong, or it's askew. It's not his signature. At that point, we call the Altoona Police Department. They will go in and apprehend this individual, and either they will charge him with our direction, or we can charge him, whatever it may be. But obviously, we have to ascertain that it is in fact a forged or altered script. We'll have to talk to the pharmacist. We'll have to talk to the doc, and once we ascertain that and get statements from both of them, we can charge the person.
Judy, are there any of our medical drug dispensing organizations that are not online?
As far as online for?
I know sometimes I go to a doctor's office and they're typing into their computer.
Oh, you mean as far as their electronic
capacity? And I hear other people say they
The
go to
records.
their physician and the physician didn't necessarily, but
Yes, there are still physicians that
I'm
probably...
still paper.
Paper.
When you come to my office, I look at you, you don't have to type it into the computer.
Right.
I think what you're getting at, to fill the prescription, to actually, once I write it and it goes to a pharmacy, that process, there's electronic there.
Okay.
Most physicians, even if they're still using the old paper charts, have access to the internet, and that's where the stuff is all based. I can go on the internet, I'll type in and say, oh, Dean was here. We can pull up certainly all the emergency rooms, all the different locations like that. The people who would be prescribing, where the origin of these medications would start, have access to the internet.
okay. We've talked briefly about individuals who are trying to fraudulently get prescriptions, but as a senior citizen, it seems to me that I may have some responsibilities here, not to let my prescription lay around, not necessarily to broadcast to people the kind of medicines that I'm taking. Is that a possibility?
Well, a lot of that comes from an education. When you're in my office and we're together and I'm going to prescribe this medication for you, I'll say, here's the side effects, here's what can happen, it might constipate you. Don't leave it laying around, don't mix with somebody else. And then when you go to the pharmacy, ideally, that's reinforced, unless there's a third-party involvement, that kind of thing. And then when you go home, you look at the stuff. You should know your medications, what you're taking. If you could help the physician in the pharmacy or in the emergency rooms anywhere, write down your medications, what they are, carry them with you like your driver's license.
On a prevention side, we also try to educate on that issue of control of your substances. If you have a medication that is addictive, you've been educated by your physician that it is addictive type medication, you really should make sure that you have control of that, it's locked somewhere, or that it's out of sight, out of access to even your own children and grandchildren or any youth coming into your home, whether it's friends of your child's that may be coming in and out of that home, because diversion typically is, once it's bought, that person may sell it on the street, but the other big diversion point is from family members, from the medicine cabinet. Someone going into the medicine cabinet, opening up and looking and seeing what you've got, and not taking your whole prescription, but taking a few out. And that's one of the areas that we try to educate individuals on, is treat it like alcohol. You wouldn't allow your alcohol, you shouldn't be allowing your alcohol access to your teens or to someone that you don't want to have getting that substance, so keep very good control of it.
Dean, I just wanted to add quickly, you mentioned senior citizens. We want to be clear that this is not a program to stop anyone from getting legitimate medication. It's someone who is legitimately obtaining medication through a doctor and a pharmacy will have no idea that this program is here. This is slated strictly towards those individuals that are attempting to divert drugs, forge scripts, alter scripts, things, doctor shop, those types of things. So we want to make sure that people who are legitimately obtaining medication don't need to worry about this program at all.
We're going to be back. That's a wonderful lead-in, Jim. We're going to be right back and talk about the threats that this presents to our community, illegal drug abuse and prescription drug abuse, and we're going to talk about robberies. Be right back.
Some banks say they're part of the community. Mainline National Bank helps build it. Volunteering, financing homes and business, being there for our neighbors when they need us. Since 1944, it's what we do. Operation Our Town has helped to reduce drugs and crime in our community. Mainline National Bank encourages you to take back our neighborhoods. Go to wearecentralpa.com and click Operation Our Town to learn more.
Welcome back. We've been joined today by Dr. Grant Hormell, by Jim Walstrom from the Pennsylvania Governor's Justice Commission, from Judy Rosser from Blair County Drugs, and from Peter Kreckel from Thompson's Drugstore. We were talking earlier about legislation that's going to make it easier for frauds to be detected and for people who are trying to abuse the program to be halted in their efforts. As part of this process, it seems to me when you confront somebody, Peter, I was a banker. Near and dear to my heart was the daily education about bank robberies. You guys must have some threats there with this drug abuse and the people that are doing it.
Ever since I started at Broad Avenue Pharmacy about 4 years ago, we've had 3 separate incidents. No one was hurt, and my boss told me from the very first day, Pete, there is nothing in that drugstore I cannot replace by going to the bank or by going to the wholesaler. So give them what they want. Do not be confrontational. It's really critical that nobody gets hurt. So we watch a lot, and it being a small drugstore and me being a rather big guy that can see well over the counter, making eye contact with everybody that comes into the pharmacy, as you're taught in banking, is really critical. To get a good description, of course, but to let that person know that you're paying attention. And by doing that, and we have excellent security cameras where I work, that the picture of the last incident at our store is as clear as my high school senior picture. We have great technology, and we do use it a whole lot. I'm not obviously going to divulge all the security measures that we have at Broad Avenue Pharmacy, but suffice it to say we're very good at apprehending those that are breaking the law. The last incident that happened at my store, from the time that the person walked into my front door till they were on their knees with their hands interlocked with the Altoona Police Department guy with a gun drawn, was 2 minutes and 48 seconds. We have an incredible response time here in the city of Altoona, and I feel very safe and very secure at Broad Avenue Pharmacy taking care of my patients.
That's wonderful. Jim, how common are robberies of pharmacies and doctors' offices? Am I correct? You guys are all threatened.
And Jim can correct me, but I think it was John Dillinger who said, you know, why do you rob banks? Because that's where the money is. We don't keep a lot of pharmaceuticals that are of any interest. I mean, if they want to steal antibiotics or blood pressure pills, knock yourself out. But there's nothing like that in my office. Cash is taken to the bank daily, so there's nothing of interest to them. However, or you're on the boulevard, you got drugstore, convenience store, and these people, you got to remember, Dean, typically if they're going to hold up a physician's office or go to a pharmacy, they're pretty desperate. They just want to, they want in, they want out. This isn't the first thing they decide to do that day, wake up and go hold up a drugstore. It's like they are at a desperate door when they get to that point. So if they come to any kind of a barrier or something, they're going to move on to the next place or just go to someplace else.
Jim, how common is this?
Actually, it's fairly common. And unfortunately, as we ramp up our law enforcement efforts, a lot of times people turn to prescription drugs because the street drugs are not available or not readily available or maybe too expensive. So sometimes when you get a person who is addicted or who really, really wants a type of medication, they turn to robbery, and they'll attempt to do it at any time, either in the light of day or break in at night and attempt to do it that way. So it's fairly common, and we see it more common. We saw it actually rise and become more common in Altoona when we really ramped up our efforts to stop heroin. People then switched over to OxyContins. They were trying to steal those because it's a very similar type high for those people. So unfortunately, we kind of push the problem around, so to speak, as we try to center in on one street drug problem. A lot of times those people don't stop doing what they're doing, so they move to the next drug, and a lot of times that's prescription drugs.
Judy, you and I have talked previously about Operation Our Town and the outreaches it has to the various organizations and the fact that we now have a unified effort to fight this. And I will tell you, I feel very safe in this area. I read about it in the paper and I hear about the incidences, but they seem to me to be a small part. We had a couple young people on our last show, and they brilliant, bright young people, and so it seems like the individuals who are creating these kind of problems are in a very small minority, but they certainly get a lot of press. And so one of the things that Operation Our Town is dealing with is a feeling of, hey, the job's done. But it isn't done. It goes on. And Judy, you're right in the center of this. Tell us what you guys are doing about this process of drug abuse, prescription drug abuse.
Mm-hmm. Well, what we're trying to do, and we've been working with Operation Our Town, and we work with other coalitions from my office, but we also do education in the schools. We also are working with the Take Back initiatives, which when you have extra prescriptions or prescriptions that you haven't used, getting rid of those, getting them out of circulation, and how to properly dispose of prescriptions. The other thing is working with the community on how to make referrals for people who need help. and making sure that there's access for assessment and treatment in our community as best as we can within financial cuts that we receive. So those are, some of the biggest issues, the prevention side, and then of course the treatment and intervention of those individuals and providing that service to them.
Building on what Judy was saying, one of the reasons I'm involved with Operation Our Town is because this community does not put its head in the sand, so to speak. When there's an issue, it's brought to the forefront. I'm involved in recruiting physicians to the area. They hear about the crime. I said, listen, you want to go to a place where it's on the table, not where you don't hear about it, because it's going on, you just don't hear about it. Another reason I'm involved with Operation Our Town is because I have a 12-year-old son. And I believe that education is the most important part of this. Someday he's going to be faced with a decision, and if he has the tools and the ability to say, you know what, that lifestyle is maybe not just for me, then that education has paid off. Groups like Operation Our Town, where it crosses the dimension of businesses, professionals, common people, the person on the street, they all support this initiative because it crosses through everybody's life. There's not a person out there that hasn't been touched by this problem, either personally, in their family, in their community, in their workplace, and by having it on the table, out in the open, in the bright of day, is the best way to combat it. If you could remove the demand, if you could remove the, I want and need this medication or this drug or this substance, then he would be without a job, and there's drug enforcement end of it, and we would all be a happier society.
Well said, Doctor.
Well, and I believe that what Dr. Hormell is talking about is very true. I mean, what we're talking about are in the prescription drug realm and the heroin realm is an opiate substance, which has a very highly physically dependent nature to it. And so breaking the change of that addiction is very hard. And so addressing the demand is very important, and that's where treatment comes in, and having good approaches to treatment that will help intervene with that. So it is a big concern, and that's why we've seen when heroin dried up, we did see the prescription drugs, because most of those prescriptions that are being diverted are of opiate nature, which is what a heroin drug is opiates.
If I might bore you a little bit with chemistry, by the way that people are using these medications that are designed in one way and using another, OxyContin is a perfect example, fentanyl is another one. When they're grinding this stuff up, it's not designed to be injected. The fentanyl patches are not designed to be chewed upon. But when they're using these things, they get a big dose right now, undesigned, as opposed to the slow, common dose. So the chemistry is counteracting the way these medications were designed. That's a huge problem that these people have no idea of what they're tampering with.
Wow, that's it. Peter, tell me, we've talked about prescription drugs, but I'm sure these people aren't trying to steal my blood pressure medicine. What are the doctors just mentioned a couple, what are the primary drugs? If I'm going to the pharmacy and getting drugs for myself, I should know what drugs I need to protect, shouldn't I? What drugs would they be that I really need to be conscious of?
Okay, first of all, I think security is important in your home. And I would guarantee I could go to your house and I could find every prescription drug you take. They're kept in 3 places. They're either kept in the kitchen cupboard, the medicine chest upstairs, the medicine chest downstairs. And by the way, the medicine cabinet in a bathroom is the worst place to store your drugs because of the humidity. People that know that will put them in the kitchen cupboards, and people can find them. So you need to really protect it, especially those with potential for abuse. And that's your pain medications, nerve and anxiety medications. The 3 incidents that we've had at the store, one person came in and wanted Suboxone, which is what they use in treatment facilities for heroin addicts to keep them from withdrawing. The second one, the guy demanded OxyContin, 80 milligrams. He definitely knew what he wanted and the right strength. And the third person that we got was calling in prescriptions on her own behalf for a nerve medication called Xanax. So it is, those are the 3 big drugs, and those are pretty much the 3 categories that we see: the opioids, the narcotics, and of course the anxiety drugs. So 2% of my patients cause 98% of my problems. I have a license to practice anywhere in Pennsylvania, as does Dr. Hormell. We picked this area because it's a great area to raise kids. It's a great area to be from and to work from. So it's good that it's out in the open. We need to discuss this so we can protect our children. But home security is really important because 20% of all kids get their start abusing drugs with mom and dad, grandpa and grandma's medicine chest.
Wow, 20% get their start by abusing drugs that are available in their own home.
In their own home or grandpa and grandma's home.
Because they just want to experiment,
Right.
or something.
I'll tell you, Dean, something I learned from Jim is what Pete's talking about typically is the high from the Xanax and the Oxycontins. These people will also want to steal these medications to subsequently sell on the street for financial reasons.
Correct. And if you're talking about, Peter mentioned OxyContin 80s. OxyContin sells on the street for about $1 a milligram. So if you have one Oxy 80, that's $80 on the street. So you can see if you come in, you steal 100 of those, or you can get a script, someone to write your script, or obtain 100 Oxy 80s at $80 a piece on the street. You have a significant amount of money in your hand.
Most OxyContin, pain control with OxyContin can be done at 10 or 20 milligrams. Very rarely would you have to go as high as 80 milligrams.
We're going to come back in a moment, folks, and I want to know where young people get the $80 to buy these drugs. That's the first question I have in my mind. And the second question I have is, what do we do with drugs when we're no longer taking them? How do we safely dispose of those drugs without putting temptation in the way of our children and grandchildren? We'll be right back. Please join us.
Be a good neighbor. At Mainline National Bank, that means helping a neighbor financially with their business, home, or child's future. At Operation Our Town, it means taking back our neighborhoods by eliminating drug use and violent crime. That's why Mainline National Bank supports Operation Our Town. Operation Our Town's mission is to facilitate partnerships between community and business, to fight drug use and crime through proven law enforcement, treatment, and prevention techniques. It was a dramatic increase in violent crime and drug use that brought about the formation of Operation Our Town in 2007. A group of concerned business leaders gathered to discuss how to address these mounting issues. What they discovered was most organizations, including law enforcement, did not have the resources needed to deter and reduce the criminal stronghold on our neighborhoods. Within a few short months, dozens of local businesses committed financial and other support to take back our neighborhoods. Partnerships were forged between Operation Our Town and existing organizations with proven law enforcement, treatment, and prevention techniques to address these areas. Since 2007, over $1 million in grants have been awarded to local organizations. Drug arrests have increased by 30%. Calls to push out the pusher have increased by 47%, and overall accidental drug overdoses decreased by 37%. But much more needs to be done. Mainline National Bank encourages you to be a good neighbor and go to wearecentralpa.com to find out how you can help. Volunteers and financial support are needed to continue this fight to take back our neighborhoods. If your organization would like to partner with Operation Our Town, or if you know of someone that needs help, go to wearecentralpa.com and click on Operation Our Town to learn more.
Welcome back. What an exciting morning. I've learned a lot, as I usually do, but now I need to learn what to do with these drugs that I have, and that my doctor may have prescribed a different drug, and I still have some left over from my old prescription. Judy, tell us what we're planning to do about that.
What's going on right now is the Drug Enforcement Agency, which is a federal agency, they are in all communities trying to make sure on a regular basis scheduling places for taking back medication. So we've had several in our community already. We just had one last fall. They also have another one scheduled for April 28th. And you can bring them anything. We bring told over-the-counter prescriptions that have expired, any of your prescriptions. Prime example was what Dr. Hormell was saying. You start on a blood pressure medication, and 2 weeks later the doctor changes the prescription because it wasn't doing exactly what he wanted it to do. So here you have this prescription now, and you don't know what to do with it. If you have those, you can bring all of those right to, it's going to be held at the Station Medical Center. Mainline Medical is helping us out. They're partnering with Operation Our Town. And you can bring all of those right to them, and they'll dispose of them. The biggest thing, though, if in between you have a medication that you really don't want left laying around until the next one's scheduled, because they're happening about every 6 months now, But say it is one of these controlled substances. The biggest thing is figuring out how to get rid of that appropriately. And one of the things we don't want to see is these ending up in our water system. We've had a lot of education in the last couple years that says don't put it into the water system. Try to dispose of it in another way. Number one, take the label off the bottle, and especially if there's refills on these medicines that could be diverted, destroy that label so that those refills are destroyed. Then also dump that into a trash can mixed with something like cat litter or coffee grounds, and mix that up in your garbage so that it's less, they can't find it and it's less desirable. So, those are the big things. If you don't want to hold on to that prescription and want to get rid of it, do it that way. Don't flush it down through the water system. We're trying to really educate people not to do that anymore.
Okay, thank you. Doctor, do any of your patients ever come back and say, have some extra medicine here? What kind
I've had that on occasion, and one of the things, I'm a pretty practical guy, and you're buying these prescriptions at the pharmacy. It would make sense to me to be able to have some mechanism in place, but we've got so many insurance companies, bureaucracies, all these different things that once that's dispensed, there's no way that they could take that back the way things are now. It's just, it can't be done. I would think that somehow there ought to be a way to have these a little more frequently, or what to do with these medications. This also brings up something that I discuss with my patients pretty regularly. Just because it's a medication that does not going to be used in abuse, it still has a shelf life. For example, you can't hang on to your antibiotic for 5 years thinking that next time you get a cold you can take this antibiotic and be okay. Things happen within that pill structure that make it sometimes dangerous to take a medication after it's expired. That's why it has an expiration date on it. From a medical perspective, I prescribe these for a period of time to see what kind of response we're going to get. If you don't get the response as indicated, that indicates to me that there might be something else going on. So if you're saving your antibiotics for when you're cold, or your pain pill for whenever the next time you throw your back out, you really have to pay attention to the shelf life of these things.
Peter, do people come to the pharmacy and say, hey, what do I do with my old medicines?
I have people come to the pharmacy with bags of pills and say, can you get rid of these for me? And we can't in the pharmacy. We can't take them back because they're
You
actually,
say you can take
we
them
cannot take
you
them
cannot
back.
take them back?
Right, because they're considered hazardous waste if we accept them. So they have to be disposed of. So again, we advise them like Judy has advised. But there are some drugs that we still need to flush, unfortunately, down the sewer system. Some HIV drugs, some Schedule II narcotics, Baraclude, OxyContin, fentanyl patches need to still be flushed to be destroyed. If you're not sure, just call your pharmacist, or call me if your pharmacist doesn't know the answers on how to dispose of these medications. So getting back to the prescription vials, though, the USP, which determines the shelf life of all products, from the time a drug is dispensed in an amber vial in a pharmacy, 1 year maximum shelf life. So there shouldn't be anything in your house for 2 or 3 years, an antibiotic that you took. After 1 year, it needs to be destroyed and disposed of, either at a take back, like Judy suggested, or the coffee grounds, kitty litter in a Ziploc bag, stuff it in your regular trash.
Wow, that's fascinating. Quite frankly, I just thought you poured them down the drain, but you're right, that does create a hazard. And now April 28th is coming. It's not exactly tomorrow. So in the meantime, you're saying take the labels off.
Well, not for the take back. You don't have to.
You don't have to.
Not for the take back, no.
Okay, and Jim, tell me about law enforcement. What does this drug disposal day mean to you guys?
Well, we generally put at least one of our agents at that facility to help with this, to help people out, to take the drugs and dispose of them properly. I will say this, we'll take almost anything. We will not take syringes. So please don't bring those in. Last time a few people did bring them in, and we were able to dispose of them in a Sharpies container, but that's a dangerous situation for everybody involved, so we really don't want anybody bringing syringes in to dispose of. The disposal of medication for us is important for all the reasons we've already discussed. Home robberies, thefts, your children taking them, all those things that you should clear those medications out. And as we talked about expiration dates on these medications, the people that are stealing these medications don't look for expiration dates. So they will break into your house and take it anyway, even though they don't break in and say, "Oh man, this is expired. I don't want this." They'll take it and they'll use it. They'll do what they have to with it. So it's an important process for us to get some of those items off the street, if you will, out of homes and disposed of properly. And then it then will stop some of that threat of people breaking in or people trying to steal or your children taking things like that.
Speaking of breaking in, we talked earlier about robberies. Peter, what is there? I understand there was some legislation recently passed in that regard.
Yes, I think our legislators are very sensitive to the vulnerability of pharmacists. When you come into a drugstore, there's not a whole lot of barriers, especially in a small store like I have. So Rick Geist sponsored legislation along with Jerry Stern, our two local representatives, House Bill number 2125, which makes it a felony to commit any crimes in a pharmacy where you obtain controlled substances, which is real good for us. It's recognizing the fact that these are indeed dangerous drugs, and they need to eliminate or punish very severely those that break those laws to try to get these controlled substances. So a big pat on the back to Rick Geist and Jerry Stern for their efforts in getting this legislation before the House.
Dean, just quickly, speaking of pharmacy robberies, one of the implementations of Operation Our Town was cops in shops. We're put an undercover officer into a pharmacy from time to time, different pharmacies, to try to negate robberies. We advertise it, make sure obviously they know that the program, everyone knows the program's available. No one knows where that officer is going to be or what pharmacy or what time. We've put clings on the doors of the pharmacies where they are asking you to take off your hoods, your hats, your sunglasses, things like that. So if you are intending to rob the pharmacy, as Peter was saying, with the surveillance cameras, we get a real good look at you. And hopefully, if that's the case where someone comes in to rob a pharmacy, would be an unfortunate day for him for there being an undercover police officer standing in the aisle when he attempts to do that. So those are all programs set forth by Operation Our Town that has really spearheaded an effort to try to negate those robberies in those pharmacies.
They also have a pharmacy chain, whereas if Pete would suspect he would call the pharmacy on this side and that side of his chain, and it would make a circle by the time. So even if the person was in the pharmacy, saw this undercover agent, left, went down the street to the other one, there'd be a phone call to start looking for things.
Maybe one of you can help me with this question. Is prescription drug abuse where it starts? Is it part of the process? I don't know what the process is now for drug abuse. Do you start on marijuana and work your way up?
I don't know that OxyContin 80s is a gateway drug. Okay, typically, if a person's going to start using something like that, they're going to experiment. They'll go through an experimental stage of maybe tobacco, alcohol at a very young age, work their way up, so to speak. And I think, and Jim could speak to this, I think it has a lot to do with availability. What's available to these kids and older people, and what can they have in financial return? When they get so far down the line that they have to have something, I can go sell an OxyContin 80 for $80, or can I, sell, I don't know, a couple joints for a couple bucks? I mean, what am I going to do from that perspective?
Mm-hmm. And it's a progression of the disease, and you're right. And you're saying, why? Why is this happening now in our community? Why does it seem like it's exploded, or that there is a high level of this going on? Well, we do Pennsylvania youth surveys every 2 years in our schools, and right now, and this is Blair County data, 75% of seniors, when they at the time they're a senior in high school, 75% of the kids have already tried alcohol. We have a progression from 6th grade up to 12th grade of kids from 18% in 6th grade have used alcohol. It goes to like 30% in 8th grade, and by 10th grade, we're at 40, 50, and 75% have already experimented with alcohol. When you're looking at a young brain that's developing, and they are putting in a substance into that brain that's already developing and having changes going on, it doesn't matter the substance. It's going to react in the brain. It changes the receptor sites in those brains, and if there's that person has some type of predisposition to that addiction, it could generate that start of that addiction happening.
A lot of this study has been done with nicotine, for example. They've found recently, within the last couple of years, that the fastest metabolism of developing nicotine receptors in our brain is during those adolescent years. This is why someone who begins to smoke as an adolescent has a much more difficult time quitting than someone who maybe starts smoking when they're 20, 30 years old.
I'm sorry, and just to back up a little bit, when you talked about availability and then Judy began talking about alcohol, let's think about that. If your child is involved in alcohol abuse, where's the easiest place to get the alcohol? In your home. An easy transition is to prescription drugs. Now, if you're a drug abuser or you want to take some type of substance, would you rather go to your medicine cabinet and take two from mom or dad or grandma or grandpa, or do you want to go out on the street, take your chances with somebody there? They're going to rip you off, they're going to hurt you, they're going to kill you, they're going to do all those things. For me, I'd much rather just go to the medicine cabinet. Same thing, the progression from alcohol to drugs is a very easy progression because the availability is in the exact same place. It's in your own home, or it's in your relative's home, or your friend's home.
This is where the education is so important. These statistics may sound like a shocker to some people, but if you're educated, you learn about it, and you're an active parent, you're an active grandparent, you get involved in your children's lives, you're going to the football games, I mean, then it's not so much of a shocker.
We're going to be right back. Please stay with us.
Some banks say they're part of the community. Mainline National Bank helps build it. Volunteering, financing homes and business, being there for our neighbors when they need us. Since 1944, it's what we do. Operation Our Town has helped to reduce drugs and crime in our community. Mainline National Bank encourages you to take back our neighborhoods. Go to wearecentralpa.com and click Operation Our Town to learn more.
Welcome back. Welcome back to Taking Back Our Neighborhoods, and we have 4 people here today that have really made efforts on that behalf. And it's a pleasure for me and an honor to be sitting here today discussing the drug abuse and the prescription drug abuse in our community and what our community's done about it. Jim, talk about that for a minute, Operation Our Town, and what has happened.
What Operation Our Town has enabled us to do is through these committees, and there are many, many subcommittees within Operation Our Town. The committee that we all happen to sit on is the Pharmacy Committee, Pharmacy Roundtable. It's allowed all these entities to be at the same table. And when we all sat down, law enforcement, physicians, drug and alcohol, and pharmacies all sat down, we immediately got into the discussions that we never had before. And one was forged prescriptions at a pharmacy. Someone comes in with a forged script, they try to pass a bad script. The pharmacist is our witness. So we need this pharmacist to come to the preliminary hearing and testify. Unfortunately, preliminary hearings are generally scheduled all day on a certain day, so we need this pharmacist to sit at the central court all day that day waiting to have this hearing. Pharmacies told us we can't do that. We can't cut this person loose all day. Is there some way to work around that? So we were able, that was just one little segment that we quickly got into that they saw. They were educating us on their problems. We were then educating on them on our problems, how important that witness is to our case. Without this witness, we don't have a case. So this roundtable has enabled all of us to sit down and talk about our problems, our issues, and get into these things like cops in shops, no hats, no hoods, the prescription monitoring program legislation. That all was born out of this one little roundtable within Operation Our Town that 5 years ago was not there.
Thank you. I want to remind everybody right now about a couple phone numbers that are vitally important. We've talked about each person's responsibility, but the question is, what do I do when I recognize there's a problem? So I'm going to share with you 2 phone numbers. The first is Contact Altoona, 946-9050. 946-9050, Contact Altoona. The second is the Push Out the Pusher Drug Hotline, 693-3020. Push Out the Pusher, 693-3020. Because these people are in the front lines, but we're the soldiers. We have to help ourselves and do something about it. And I think that's everyone's responsibility. Is that what you found, Judy?
Yes. I mean, when you look at Operation Our Town, it is a perfect example of prevention at its best, with the activation of a community. Who better knows what our issues are than Blair County citizens? And it's bringing the disciplines from the different areas of our community, whether it's law enforcement, pharmacies, physicians, it's human service workers, it's gang experts that understand any kind of gang stuff that may be going on in our community. It's the government being at the table. They've brought all the different sectors of our community together to start talking. That is just an amazing feat, and has really set up these roundtables to provide an opportunity to really problem solve, like Jim had said. So when you're looking at that, that is an exciting way that Operation Our Town has brought us together. But the big thing is we can't quit with that. I mean, yeah, a lot of things have changed and they've done a lot of good, but you've got to keep that pressure on, because as soon as there's a hole or a vacuum, they're right there ready to go. Because number one, drug dealing is a business. And what we saw 5 years ago prior to Operation Our Town, we saw drug dealers coming in from outside of our community to come make money in our community by dispensing illegal substances. I don't know if Jim would want to add to that.
That was absolutely a huge problem for us, and within this Operation Our Town group, as Judy was saying, we brought all these different disciplines together, and now, 5 years ago to now, I'm more involved in education than I've ever been, and prevention. And Judy, I'm sure she would say that a lot of times she's involved in more of the enforcement end of it, because we've been able to sit down at the same table, and she educates me, I educate her, so we go back and forth. So now, as a law enforcement officer, I understand that if I put you in jail for 120 years, I'm probably going to rehabilitate you, but I can't put everyone in jail for 120 years. So the people that I can't put in jail, I know I have to educate you, and I have to educate you at a very, very young age. And we spend a lot of our time doing that. I spent the whole summer in every school in Blair County talking about Blizzard and the chemical, illegal, now illegal chemical drugs that were out there. So we spend, as law enforcement, spend a lot of time in education, and part of that is because we were educated through these roundtables of Operation Our Town by drug and alcohol people who know education, and we all realized that before. 20 years ago, we just locked everybody up, and that was our way. We still lock as many people up as we can, but we know that we can't do that. We need to educate as well.
If you could somehow stop the world and take these people before they get involved with these things and fulfill the need, the void that they feel that they have to reach for some substance to take care of their emotions or whatever it is that they're going after. Stop them before the experimental stage. That is prevention by definition. And being a prevention specialist in family medicine, you could translate those same principles to these people before they start. And then the demand would go away, and then there's the end of your problem. However, the real world you can't do. You have to do it all at one time. And that's one of the things about Operation Our Time. It brings everybody to the table at the same time to talk about these dynamic changes. And from my understanding, it's a model statewide, if not nationally. People are looking to this community, say, hey, how'd you guys do that?
Yeah, I was impressed when I interviewed the individuals who really were the formula group to put this together. I thought that it was a program we had borrowed, but it was our program. And I was just so impressed, not just with the people that started it, but the people that joined in. People that recognize the
people
problem.
Were frustrated. Enough is enough. And as far as the push out the pusher hotline, just because you don't see a transaction happening, if you suspect, if you have a question, if you have anything, you call that. It's going to be investigated. So people who are the eyes and the ears on the street, so to speak, don't be afraid to use that number.
In that robbery that happened at my store, the incredible response time from the Altoona PD can also be attributed to some neighbor across the street saw this knucklehead that was going to rob our store. He was getting dressed on the corner of 24th and Broad. He was putting on black pants, a black hood, and he put his mask on. And one of the neighbors actually called in and reported that, and that gave even a better response time. So we need to be involved. The little old ladies peeking out the curtains, we need you. If you see something suspicious, call either the push out the pusher number, call 911, like that fortunately somebody did before they were robbing my drugstore. So you need to get involved. We are a community, and you have to work together, because as this community grows and becomes a great place to live, we need to all be involved in that, and we can all do our fair share.
Peter, thank you. Peter Kreckel, Thompson Drug Stores, thank you for joining us
Thank you.
today.
My pleasure.
Judy Rosser, Blair County Drug and Alcohol Program, thank you for your time and your efforts continually in our community.
Thank you for inviting me.
Jim Walstrom from the Pennsylvania Office of Attorney General, I'm sure you and your cohorts maybe put your life in the line every day. So thank you for what you do for our community.
You're welcome.
And Dr. Grant Hormell, to your patients who are waiting in your waiting room, I apologize and thank you for your time. You're a very valuable contributor to this
Thank you very much.
discussion
It's been a privilege.
and a different insight. Young people starting at an early age to get addicted at home on cigarettes and alcohol. Quite frankly, I took that for granted. I'm never going to take it for granted again. That's a serious doorway to future problems.
You've just been educated, Dean.
I have been educated, and I thank each of you for that opportunity. And I encourage you out there, get involved. Call those phone numbers. Volunteer your time. Volunteer your efforts. Donate money. Keep this process going. It's not just about us. It's about every young person in this community. We are the lifeboats. We are the lifelines. We are the educators that are going to make them a better future and are going to make us a better place to live. I don't know how much better it can get because Blair County is a really good place. But thank each of you and thank all of you for watching.